Welcome to another episode of The Take. In this episode, I'm going to discuss the 2001 Abuja Declaration. With the discovery of a new COVID-19 variant in South Africa that is more contagious and that is fast spreading across the continent, it is very necessary now to discuss the 2001 Abuja Declaration. The new COVID-19 variant carries a mutation called E48K and is reportedly even more contagious. It was discovered in the last months of 2020 in South Africa. And as of the 5th of January 2021, this variant has been detected in 6 other countries: the United Kingdom, France, Switzerland, Japan, Austria, and Zambia. This is according to the World Health Organization. To say that this is a critical threat to already struggling public health sectors across the African continent is an understatement. Public health sectors across the African continent have been experiencing a severe shortage and lack of critical and life-saving equipment such as ventilators and intensive care beds and units. According to the World Health Organization, in mid-April 2020, there were just 2,000 ventilators across 41 African countries and 5,000 intensive care beds across 43. 10 countries reportedly did not even have ventilators at all. Furthermore, African countries have some of the worst patient-doctor ratios in the world. But even before the COVID-19 pandemic, more than half of all people across the African continent did not have the necessary access to medical care. So, what is the Abuja Declaration and why is it so relevant to the COVID-19 pandemic in Africa today? About 20 years ago, African leaders and representatives of governments met in April 2001 in Abuja, Nigeria. In this meeting, African leaders pledged and committed to allocating about 15% of their national budgets to health. The goal was simple. African leaders were trying to respond and improve the quality of healthcare service delivery of already struggling public health sectors across the African continent. By 2011, 27 African countries had somewhat increased the proportion of their expenditure allocated to health. However, only 2 countries, Rwanda and South Africa, had reached the 15% target. 7 African countries had actually reduced their healthcare budgets as a proportion to their national budgets. By 2016, the situation had degenerated even more. 19 African countries were actually spending less on health as a percentage of their public spending than they were in the early 2000s. I think it's clear and safe to say that the potential and promise of the Abuja Declaration has not yet come to fruition. So, I guess the real question is, what happened? This is a very difficult question to answer, and I wish there was an easy and clear explanation to this. But upon reflection, I've come to 2 main points that could explain what happened to the promise and potential of the Abuja Declaration that is yet to be fully realized. I think the first point has to do with the idea that the prioritization of health, at least in the way it's stipulated in the Abuja Declaration, has just not been a main priority for many African countries. And this has been very visible both in countries with relatively higher per capita incomes and those with lower per capita incomes. For example, in the first category, we see countries like Algeria, Botswana, Seychelles, and South Africa. These countries have not been consistent in prioritizing health as declared by the Abuja Declaration. But this is also visible in countries with relatively lower per capita incomes like Zambia, Niger, Mali, and Mozambique, for example. The second point just has to do with African countries having different priorities when it comes to development and too much dependency and reliance on donor spending for health across the African continent. Actually, it was reported that in 2017, about 20 African countries had huge dependency on donor funding to support a significant portion of their health sectors. The main issue that I have with such a heavy reliance on donor funding for such a critical sector like the health sector is that donor funding is neither guaranteed nor consistent. We saw a great example of this at the height of the 2008 financial crisis, when donations and funds reduced dramatically across the African continent. And this very phenomenon is projected to happen right now when world economies are consumed with the effects of the COVID-19 pandemic. One of the main things that really impresses me about the Abuja Declaration is its pragmatism, its boldness, and commitment to improving preparedness, and its emphasis on meaningfully and systematically investing in the healthcare sector. It highlights that this is incredibly crucial to ensuring the overall improvement of service delivery, quality of health, and access to health across the African continent. So here's an example that just shows how doing so is so crucial in saving lives.
We have been planning for any kind of pandemic that may affect Taiwan. And the reason is because back in 2003, Taiwan was hit very hard by SARS.
So let me get this straight. You had been planning for a pandemic for 17 years?
Yes, and it will not stop.
They already had a command centre ready to activate and generous stockpiles of protective gear. And Taiwanese companies invested in high-tech solutions like these robot testing machines. Crucially, the government started warning the public of how serious the new virus was back in January. The health minister even broke down in tears as he announced a new infection.
With a population of almost 24 million people, Taiwan has only had 7 COVID-19 related fatalities. And with rapid and effective contact tracing, fewer than 850 confirmed COVID-19 infections. This is despite being 130 kilometers from mainland China. Taiwan is a shining example of what preparedness and meaningful investment in a health sector can do. With a new contagious strain of COVID-19 and neglected and overwhelmed public health sectors across the African continent, Africa might just be the next epicenter of the COVID-19 pandemic, and that would be disastrous. If the COVID-19 pandemic does not reignite the commitment and political will to ensuring that the 2001 Abuja Declaration finally comes to fruition, I honestly do not know what will. Thank you so much for joining me on this episode of The Take. Make sure to check out our channel to see other videos and to subscribe so that you don't miss future videos when they're uploaded. Regarding the Abuja Declaration, I strongly believe that each one of us has a role to play to make sure that the Abuja Declaration finally comes to fruition. And I think we can play that role by ensuring that the Abuja Declaration comes back on the agendas of our local governments in our local context, to ensure that governments can finally live up to the expectations and commitments of the Abuja Declaration. Until next time, this was The Take.